as we transition from the summer into the fall season, and as we continue to have more questions pop up about COVID-19 and the future of this pandemic, more people are experimenting, and there are also common hazards that are there everywhere in our everyday life that we should be aware of and be trying to actively avoid, or at the very least, be ready to respond to should we fall victim to them in our own homes, in our workplaces, and out in the regular world. And to talk about some of those hazards and ways we can avoid some of these issues, we're pleased to be joined once again by Dr. Varun Vohra. He is the Academic Director and Clinical Toxicologist at the Michigan Poison Center. Dr. Vohra, thanks for being with us today.
Thanks, Tyler.
Appreciate having you on. Let's start with a more concerning and COVID-19 related issue that's coming up right now. There have been some people that have been trying to treat COVID-19 or prevent COVID-19 without getting vaccinated, without the mask wearing, and instead taking Ivermectin, which is an animal drug that is used for cattle and horses. You would think that would be common knowledge that a medication that is intended for other animals is probably not safe for humans to ingest. But in this case, one, why are people taking these? What do they think it's helping them do to prevent COVID-19? And then on top of that, why is experimenting with these drugs meant for other animals so dangerous?
Yeah, so it's a trend that we've noticed, and we did see a spike, at least from our center, in calls related to ivermectin exposure shortly after sort of the national emergency was declared around April, May last year. And as well, there's a random spike in April of this year. Seems to be calming down a little bit, at least in this area. But other states are definitely experiencing a surge in volume related to these cases of ivermectin, people using ivermectin. So Alabama and Mississippi especially have reported cases, and even Oklahoma, Mississippi recording up to 70% of certain calls in a certain time frame related to ivermectin. So you're right, ivermectin, it's known as kind of a dewormer. It's for like parasites in horses and cows, but it can also be used in humans as well. So it does have some indications for things like head lice and skin conditions like rosacea in humans, but those are solely indicated for those purposes. So as far as for COVID-19, there's an ongoing research out there currently, in vitro studies, so more, not in humans, showing that it might have a potential effect against certain viruses like COVID-19. But again, there's insufficient evidence at this point. And the NIH has found no current evidence to suggest that it's going to be useful in humans so far from the clinical trials that have been done. So it is something that we're actively monitoring. And why people can get into trouble with this is because people who aren't consulting healthcare professionals, who aren't doing their homework and not complying with the advisories from organizations like the FDA, if they're taking certain doses that are meant for things like animals like horses and cows, those are big animals. So it's highly concentrated material where you're taking doses meant for animals that are immensely larger than we are normally, the average human, right? So that puts people at risk of toxicity. And ivermectin can have toxic exposures in big doses. So you can see things like rashes, mostly GI symptoms, especially abdominal pain, vomiting, nausea. There are reports of seizures out there as well, and low blood pressure, high heart rate. So those are things that we definitely want to avoid.
We're talking with Dr. Varun Vohra from the Michigan Poison Center. He's their academic director and a clinical toxicologist with the Michigan Poison Center. And just to complete the circle on that first issue with ivermectin, in a statement from the FDA on Saturday, they tweeted out, "You are not a horse, you are not a cow. Seriously, y'all, stop it." So that's right. About it, the best way to put right. That. You're not a horse, you're not a cow. So
exactly.
Consult with your doctor before medicating with things that are meant to be prescribed. Other issues that are currently affecting some people across the U.S., there have been a number of food recalls, frozen cooked shrimp, hamburgers, hot dog buns, frozen chicken. How should people go? What would you suggest, or what would the Poison Center suggest in terms of people going about understanding if the food that is in their freezer, is in their refrigerator, has been recalled, and what should they do after they come under the understanding that they have recalled food that's in their home?
So I think the first thing that I would recommend is, being up to date with the advisories, especially, going to the CDC website and the FDA website. They do have lists of certain agents and certain food products that have been recalled. And then do essentially a cross-reference with the materials that you have in your fridge. And if there's any doubt, I think, the best piece of advice would be not to engage, right? And to get rid of those food items because we don't want to risk, the risk benefit profile is not favorable in those situations. And, I think the most important thing would be, if you have any questions, again, you can call us, right? So we not only deal with poisoning emergencies, but also information. So whether that's related to drugs, food, what have you, please call us, and then we'll be happy to answer those questions because we have specialists on hand that can get you that information really quickly.
Dr. Varun Vohra joins us on the MegaCast. He is the Academic Director and Clinical Toxicologist at the Michigan Poison Center. And for those that may become affected by these recalled materials, how do they know the difference between them just having some adverse reactions to certain foods, as many people do have, versus food poisoning? How do you tell the difference between one versus the other?
I think the main thing that they're going to share similar symptoms, mostly GI symptoms, the nausea, the vomiting, the abdominal pain mostly, which can start relatively early. But I think if it continues to progress and it's protracted and it's not going away, if you eat something kind of spoiled, usually you'll be sick for a little bit and then eventually it'll get better with hydration and whatnot. But otherwise, with true food poisoning, these things can last a long time, several days even. So if you're not getting better, or if you're noticing that symptoms are getting worse even, I think the best thing to do, there's several options. You can either call the Poison Center, 1-800-222-1222, or go to your local urgent care, or if it's really, if it's advised from, say, the Poison Center or whoever, a healthcare professional that you might see at the urgent care, there might be a need to go to the emergency department for a workup.
We're joined by Dr. Varun Vohra. He is the clinical toxicologist and academic director at the Michigan Poison Center with us today on the MegaCast. And with marijuana being legal now in the state of Michigan, and we're seeing more of the dispensaries pop up, and more people are being able to have access to cannabis and to cannabis products, but that also raises some concerns for those materials, much like alcohol or over-the-counter drugs in the home, being able to be taken into the possession of children or ingested by children, particularly young children. What are some of the adverse effects that can be had if for example, a young child or a child 0 to 19 years old is then taking marijuana edible from their parents' medicine cabinet or wherever they store their cannabis materials? What kind of effects can that have on a child?
Yeah, so I think, you bring up a good point, is that, especially the edibles can be of particular significance, just because I know there's been a big push recently from regulatory agencies within Michigan to push for altered packaging, because historically the packaging has looked very attractive. It's colorful. It looks like candy. So those things entice young people, whether it's experimentation, inadvertent ingestions, what have you. People can get into these things, especially kids, thinking that they're gummies and candies and whatnot. So, and they're infused into food products like brownies, cookies and what have you, at higher doses. So sometimes they can reach up to 20 times the dose in a regular marijuana joint. So, adverse events that we typically see, you'll see that sort of central nervous system depression, so that, loss of coordination, drowsiness, sedation, lethargy, sometimes vomiting. And then as well, it can lead to, fast heart rate, and eventually that'll work down, depending on how severe it is, it could lead to a lower heart rate and lower blood pressure as well, which we don't want. That's pretty significant, and significant in children as well, because they have a lower body surface area, right? So it doesn't take as much product to get into trouble versus doses or products that are meant for adult consumption.
We're joined by Dr. Varun Vohra from the Michigan Poison Center. And Dr. Vohra, with that being the case, with the effects that this can have if these products are ingested by children, and you talk about some of the ways we can prevent them getting this into their possession inadvertently by changing the packaging. But it brings up the question, I think a lot of people would then have the question, should marijuana edibles be something that is deemed eligible and legal under the state's marijuana legality laws because there is that chance for confusion? Should we even be putting those products out there because of their concentration of THC and in some cases just CBD and the effects that can have if it's inadvertently in the possession of a child?
Yeah, I think, that's definitely a broader discussion because, we have recognized the therapeutic effects of things like
Yes.
THC and CBD. So I think that would run into a lot of legislative hoops, to be honest, and bureaucracy. But I think there are certain things that we can do and that people can do, every day to mitigate potential exposures in children. So first thing would be to keep them plainly out of sight, out of reach of children. And then a big thing also, don't consume these products around children, because if they see you doing it, they might be curious and might be interested. And then, the phone rings or you get distracted, you might leave these products out, right? So I think the best thing to do is to do them away from children, maybe after they go to bed, or whatever the case may be, and then keep them in, even a locked cabinet, keep them in their original container, or even put them in a new container that has, a lock into it or a lock to it that may be a lot more difficult for children to access. But as far as, outright prohibiting these substances, I think there's been a big push to get these substances permitted, that I think it would take a lot of undoing, especially with the now known therapeutic effects of these agents.
So with that being the case, what should parents be doing? What action should parents take if they do suspect that their child has taken an edible and is not and has done so accidentally, has taken an edible? What action should parents be taking?
So I think the first thing, and working at a poison center, I think the first thing is, try not to panic, and then, call us. So again, the number is 1-800-222-1222. For locals, you can call 313-486-0078, and that'll reach us as well. In the event that you can't get through right away, we have trained specialists on hand to kind of walk you through the situation, and they'll gather all the information necessary as to what you think happened. That may require just observing the child for a little bit to see if they are not behaving like they normally do. It's going to rely heavily on the parents noticing any potential symptoms. And if it's completely unclear and there's a possible case for significant exposure, we will make the recommendations going forward to go to an urgent care or ED to be safe, to get the child worked up, which will usually require an observation period of typically like 4 to 6 hours to see if anything occurs, and knowing that they're in safe hands. But I think the biggest thing is to know your resources and give us a call immediately if you do suspect that. Above all, do not make the child vomit. I think that's the most important thing. That's kind of an antiquated behavior that has happened well in the past, but we no longer recommend making the child vomit, because that can lead to a whole host of other symptoms potentially, such as aspiration, where you get it into the lungs, and that can lead to things like infections and a whole host of badness.
Dr. Varun Vohra joins us on the MegaCast. He is the academic director and clinical toxicologist at the Michigan Poison Center. And Dr. Vohra, as we're transitioning out of summer and into the fall, what are some common hazards that do arise at this time of the year in that transition in the home and also in office spaces as well, that people should be aware of, and some ways they can prevent falling victim to those hazards?
So I think there's several things. I mean, even looking in your garden. So one would be pokeweeds or pokeweed. So this is kind of a plant that has what look like edible berries or grapes that can be found in the gardens and crops. And typically they arrive in late summer and go through winter. And that can cause a lot of issues especially amongst children who get into them. Can cause a lot of GI upset, a lot of vomiting, and pretty severe adverse effects depending on how many berries are ingested. I think the most important thing to do, the whole part of the plant can be harmful. The root is the most toxic. So if you do notice pokeweed saplings, say in your garden, the best thing to do would be to dig them up from the root upwards, let them dry out away from, other plants, other things, children, what have you, and then, toss them out with your yard waste. I think that would be the most sensible thing to do. And again, if you have any questions, just call us and we can help identify it for you. If you take a photo of it and send it to us, we can help you confirm what it actually is. Other things that we've seen recently an uptick in is liquid laundry packets. So, those detergent packs. And I know those have been a pretty common trend since even 2012, when the Consumer Product Safety Commission put out the warnings out there about, those pods that children can get into. So recent studies that have come out have shown that those liquid laundry packets, compared to traditional detergent, the liquid detergent that you just pour into the washer, they have increased odds of going emergency department visits compared to traditional laundry detergent, and even greater odds of upwards of 8 times the odds of a more serious outcome in children, especially children younger than 6. So these things can cause vomiting, it can cause burns in the throat, it can cause eye problems as well, if you like ocular damage, if they get in the eyes or even the skin. So there've been initiatives made by the American Society of Testing Material in 2014 to create standards to make it more safe and try to mitigate these exposures. So that includes kind of coating the outer film with an aversive product that makes it taste really bad, taking longer time to dissolve as well, and then clearly labeling the hazards associated with exposure to these products as well. So we've seen a mitigation in exposures and more serious outcomes, but still they're always kind of a hazard. So prior to the summer, we had about 19 cases per month on average, but since May, we've seen about 35 cases on average. So it's something that we're trending and continuing to look towards, and we're going to continue to do outreach education about this, letting the public know the potential dangers.
Dr. Vohra, we appreciate your time. Thanks for being with us today.
Thank you.